Have you ever wondered how drug products are tested for quality control? Let's explore the universal quality control tests for drug products. The appearance of ointments and creams is critical. Factors such as color, consistency, and foreign matter are evaluated against specific criteria. For example, the acceptance limit for color may be defined as a specific color range or a requirement for the product to match a reference standard. Similarly, the acceptance limit for consistency could be defined in terms of a specific rheological behavior or viscosity range. The pH of ointments and creams can impact stability, compatibility, and skin tolerance. Acceptance limits for pH are established based on the specific formulation requirements and intended use of the product. For example, a pH range of 4.0 to 7.0 may be specified for a topical cream intended for dermatological use. Uniformity of content ensures consistent dosage delivery and efficacy of the product. Acceptance limits for content uniformity are established based on statistical measures. For example, the acceptance criteria for content uniformity could include a requirement that the active ingredient content falls within a certain percentage range, such as 95 to 105% of the labeled claim, with a specified acceptable variation, example, not more than 5% relative standard deviation. Stability testing evaluates the product's physical, chemical, and microbiological stability over time. Acceptance limits for stability are established based on stability indicating parameters of the product, such as appearance, pH, active ingredient content, and microbial contamination. These limits are defined to ensure that the product remains within acceptable specifications throughout its shelf life. Sterility testing is essential to ensure the absence of microorganisms in drug products. Two common methods are direct inoculation and membrane filtration. The use of such rigorously validated and appropriate methods is necessary for performing the sterility test. The first method is what's called direct inoculation method. This technique involves the aseptic transfer of a sample drawn from the test product solution into a medium specifically intended for sterility testing. Before employing this method, it's essential to confirm the test product solution itself does not suppress the growth of standard microorganisms. Another method is membrane filtration method. This method sees widespread use across the industry, and the circumstances warranting the use of this method are 1. The requirement of a sterile fluid to cleanse the filtration apparatus of any microorganisms present. 2. The need to remove any product residue that could impede the growth of microbial cells. And lastly, the prevalent use of commercially available, pre-sterilized systems.